Hi, good day. I am Michelle, your nurse for today. Just for verification purposes, may I know your name, please?
Hi, I'm Beth Jones.
How do you want me to address you?
You can just call me Mrs. Jones.
All right, Mrs. Jones, how are you feeling today?
I'm actually not okay, nurse. There are too many thoughts in my mind right now, and I'm very nervous too. I'm going to have my appendix removed, right?
Yes, Mrs. Jones, that is right.
That is the reason why I'm very worried and nervous. This would be my first time undergoing a surgery. I just feel so tensed.
It is indeed difficult to deal with since this is your first time. However, the appendectomy or the surgery that we'll be doing to remove your appendix is really necessary in order for your appendicitis to be treated and to prevent you from further harm. The treatment needs to be immediately done. When the conditions goes untreated, the appendix can burst and release bacteria and other harmful substances into your abdomen. This can be life-threatening and will lead to a longer hospital stay.
But I am afraid I might die, just like my uncle, who died after a bypass surgery. I don't want to do it. Just give me some medicines or any other thing, but not the surgery.
Mrs. Jones, I understand that there is fear within you due to what happened to your uncle involving a surgery. That during surgeries only occur when other complications exist within the patient. Now, appendectomy is the standard treatment for appendicitis, and we are going to do it urgently so that we would avoid the rupturing of your appendix. It is actually the easiest and most effective way to treat your condition. Rest assured that this is all for your welfare, and we are going to be very hands on all throughout this journey.
Is that so? Then what could be the possible complications after the surgery, nurse?
Appendectomy is a simple procedure, but there are some risks associated with it afterwards, such as bleeding, wound infection, and blocked bowels. Don't worry because they are all manageable, and as your nurse, I am going to make sure that I will monitor you closely before, during, and after the operation.
I'm slowly understanding things now. Well, I guess I should really undergo the surgery so that my condition will already be treated. All right, nurse, I will proceed with the appendectomy.
Awesome, Mrs. Jones. This is also for you and your welfare. Now, I will be giving you some instructions before the procedure.
Sure, go ahead.
First, the doctor will explain the procedure to you more thoroughly. Second, you will be asked to sign a consent form that gives your permission to do the surgery. You need to read the form carefully and you may ask questions if anything is not clear or if you want to clarify something. Then your provider will ask questions about your past health. He or she will also give you a physical examination. This is to make sure you are in a good health before you have your surgery. You may also need blood tests and other diagnostic tests, although you might not eat or drink anything for 8 hours before the surgery. You may be given a medicine to help you relax before the surgery. And we are also going to take note of some information, such as the medicines that you have been taking, if you're pregnant, or if you have allergies as well.
I see. Thank you. I'm feeling quite relieved now, although I'm still a bit worried. At least it isn't like before.
No problem, Mrs. Jones. I am always here for you, along with other nurses to guide you and help you get through the procedure that is needed. Everything will be fine as long as the doctor's instructions will be followed. Do you have any more concerns?
I think that would be it for now. I will just call you if ever.
Yes, please do so, Mrs. Jones. Again, I am Nurse Michelle, and I will be at the nurse's station if ever you would need me.
All right, nurse, thank you again.
You are most welcome.